And we're back on this Saturday morning, final segment, Sports Medicine Weekly, and it's our Ask the Doctor segment. You can go to our website, sportsmedicineweekly.com, go to the homepage. Underneath our picture, you can submit your question under the Ask the Doctor link. So do that, and we've got a caller on the line. Dr. Cole, it is Adam from Lincoln Park asking you a question. Adam, thanks so much for joining us here on our Ask the Doctor segment. What's your question for Dr. Cole?
Dr. Cole, a few months ago I was working out, and I was doing squats with a dumbbell out in front of me, and it slipped out of my hands, and it happened to crack the bone on my big toe.
Ooh, painful.
And now it's healed, but my recovery's been rough because when I'm doing lunges or exercises similar to that, my left leg feels significantly weaker, and it's being strained when I'm trying to work out my legs individually. And I was wondering what the best way to get out of this or recover from that would be.
So let me ask you one question. Did you ever notice that you had left-sided weakness before you broke your toe, or this is something you picked up afterwards?
It was definitely picked up afterwards.
Yeah. So, after you break a toe, which is incredibly painful, you probably wore some type of shoe or just open toes, so forth, that you protect your weight bearing. You're kind of limping around and you're favoring that side. And the first thing that happens is the side that you're favoring deconditions. So you can work sort of with a trainer, you can work on your own, but you really have to go through a reconditioning program. And while you don't want to neglect your right side in favor of correcting the left-sided weakness, you're going to have to spend a little more time and effort on your left side. And the other thing that often develops is that you get stiffness and lack of flexibility when you're favoring a side that's been recently injured. So what's going to be really important as you recover from this weakness is that you work on stretching prior to working out. You're probably going to have to put more time and effort and work on multiple muscle groups. Don't get muscle memory, which means you don't want to do the same workout every day, every time. You want to mix it up. Don't forget about your glutes, which is up in your butt, which is one of the most important muscle groups that will shut down, and working on your hamstrings and your quadriceps, and even calf raises and toe raises and things of that nature. You basically just have to recondition, and if you think about it, it takes about 6 weeks for a fracture to heal. So my guess is you were laid up for at least 6 to 8 weeks before you could do anything. So it's going to take probably at least that much time, if not twice that time, to recondition that side to get it to be symmetrical or the same as the other side. So I wish you luck, but it's going to take a little bit of work. There's no magic pill, but you'll get there if you pay attention to the details.
Appreciate it, Adam. Thanks so much for the call from Lincoln Park. Continuing on our Ask the Doctor segment. Again, if you've got a question for Dr. Cole, submit your question to our website, sportsmedicineweekly.com. You'll find the link on the home page. I've got one for you, okay? And this is a true story here. My 11-year-old son comes home from his first football game last week, and he's got no pain, but water on the outside of the knee. I mean, I'm saying water or liquid.
Yeah.
I always call it water on the knee. Just a little sack, right on the knee bone on the side. No pain, though. And I keep asking. This is now a couple of days, and I've said, Monday, Tuesday, any pain? No, but it's still there. It's not decreasing or increasing in size. All
right, so I'm assuming it's not something that we call pre-patella bursitis, which is where there's a big fluid sac in the very front of the knee. This is off to the side.
On
is
the
that
side,
correct?
yes.
Yeah, so he probably has, the old expression is water on the knee.
Yeah.
But the accurate name is an effusion, which means a collection of fluid in the joint.
Yes.
And it usually comes about not because of trauma or a cartilage tear or meniscus tear, ligament tear, but because of his sudden change in his activity levels. So we see this even in professional basketball players when they go transition from summer to camp. They ramp up their activities abruptly, and the joint responds by producing fluid in the joint, and the joint swells up. And the fact that you're seeing it on the outer side is not really meaningful because it shows up in the area where the skin is the thinnest, right? So the fluid is in the joint, but you're seeing this sort of outpouching of fluid in that area, and where you see it is not related to what's causing the problem. What do you do for it? And you could ignore it, and my guess is it will just go away by itself, but he should really be icing for 20 minutes after he practices, and if it bothers him, he can put an ice pack right on that area, the whole joint, to quiet the joint down. Not just the swelling area, but the knee itself. Pack it in ice for 20 minutes after he practices.
Wow, because it's interesting, because we were on vacation. We're on a cruise, And by the way, on the cruise, amazing. Let me sidestep. Let me sidestep because it's the first time we went on a cruise ship called Oasis of the Seas by Royal Caribbean Cruise Lines. An amazing ship, 6,000 passengers, just fantastic. But they had a wonderful fitness spa. Weightlifting, the whole thing. And for the first time, I've got two boys, 14 and 11, as you know. I said, we're going to go work out. And they were like, great, Dad. I lifted with them.
That's the best.
3 days. Most I've ever worked out on a vacation. I think I worked out 4 times. Yeah. My wife did almost every day. I took the boys to 3 weightlifting sessions. Yeah. It was.
Did you get a trainer? Did you do a trainer, or did you do
we did.
Up yourselves?
But I just wanted to show them. I've never had a personal trainer. I worked out with personal trainers, so I think I know how to lift weights properly, meaning really slow, and doesn't matter what kind of weight really right technique. That's what I was trying to teach them, and they were really accepting that, which was great.
I will tell you, my middle son, he and I will work out. The summer's been crazy, but we'll get into it now. And we will work out together at least once a week, but maybe twice a week.
It's great.
And it's my favorite thing to do. I mean, that's time you have together. And, if your kids are listening to you, that's the first thing. You have a 14-year-old, he's 17, and he knows a lot about working out now. So your kids are just getting into it. But it's nice if you can come up with some kind of program with them and do it once or twice a week with them. And if you get it in once a week, that's an amazing thing. It's just great time to spend with them.
Well, I wish we were on the cruise ship, obviously full time. We are not. But what I'm saying is they let kids in. I just had to sign a waiver. See, I go to my gym, and I'm not allowed to bring them because they're under 18.
Right.
But this was the best part, Dr. Cole. After the first workout, we're swimming or eating or something. They go, Dad, we going for a workout today? I want to lift today. Yeah. They asked me to go back, best. And then the next day they asked me again.
Yeah, that's the best.
I said, "Wow, isn't that great?"
Yeah.
And I said, guys, forget about how much you're lifting. Let's do the right technique. Because I guarantee you. Corey's my 14-year-old. He's already been lifting for hockey during the summer, so he's learned a couple things. I said, "You're going to go to your high school gym, and Troy's going to go to his middle school gym, and they've got weightlifting areas." And I said, "You're going to see kids that are straining and not doing anything. You're going to laugh at them because it's not the right way to do it." And kids think they just say, you know what I'm talking about. And so I said, "Do it the right way." And doesn't matter what kind of weight, but if you have the right technique, a coach is going to say, "You know what, you're doing it the right way." And I was so proud.
Yeah,
they were really
get better results. Yeah, no, it's great. And then the key issues are actually listening to you. So that says a lot.
But the trouble was the 11-year-old, after he did a set, I said, "I want you to rest for a minute." He ran to the next machine. He goes, "I don't want to rest for a minute. I want to do the next thing."
Right.
I said, "No, you got to rest."
Yeah.
But it's the first time he ever lifted weights. He's a strong kid, but he plays high-level baseball, basketball, football, travel teams. But,
do you bring him to the games? Will you bring him to games at all this year?
Bulls?
Yeah.
Oh, yeah.
Good.
But they're so busy. I think we get to 2 games a year. They're so busy. We have something almost every night with all their travel sports.
Yeah,
even though they're playing basketball, they're practicing for baseball in the winter, and the other one's got hockey and baseball. So it's busy.
I will say that we've been very lucky, and our kids have been involved with sports, but they're sports that they're not doing 5 nights a week. A lot of my friends' kids are doing hockey, they're doing baseball like your kids, and it's every single day. And my kids have done crew, and they've done sailing and things like that. They're softer sports, but they're the good part is it doesn't happen every single night, and not every weekend is a killer. We're not traveling all over the world to go to tournaments and so forth. So we've been very lucky because they're around a lot, and our schedule's not completely controlled by them. But most of my friends are like you, where your life is.
But I wouldn't trade it. I wouldn't trade it.
I get it. You work, and then basically the rest of your schedule revolves around your kids.
Yeah, some parents say that, "Oh, no, we got to practice," and I live for it. If I don't have a Bulls game, I'm hoping I can go watch my son play hockey or basketball or baseball in the winter.
They'll always remember that.
Oh, it's fantastic. Love that. So, but thanks for that advice. That was great stuff. Because I was worried, because I'm telling my son, playing junior doctor, because I do this show, right?
Yeah, so what did you tell him?
I said, if you were a high school or probably college or pro athlete, they would probably drain that fluid. I'm wrong then.
Not right away. No, I mean plenty. The
water on the knee. I got scared.
Yeah, a lot of people carry an effusion or swelling after being really active, and the first time it happened, it's a little freaky, but it probably will go away and it won't continue to reoccur. But look, if it does, I can find you a good orthopedic surgeon if you need someone.
Yes, you can. Dr. Brian Cole, Midwest Orthopedics at Rush. I'm Steve Cashel. Thanks so much for listening, everybody. We're out of time. Many thanks also to our producer, board operator, Shane Reardon, coordinating producer, Teresa Ann Seeger. Also to David Cole and Samantha Smith. Coming up next, Inside the Clubhouse with the one and only Bruce Levine. This has been Sports Medicine Weekly, only on
670 The